Trauma-informed care as a term started in medicine really as an approach to care that really took trauma into account when beginning to diagnose and treat individuals who were presenting with physical illness. It had its genesis in the 70s when physical and mental traumas that were experienced by our Vietnam War vets really came to the fore. And the aftermath or the lingering issues that really intersected were ones that were necessary for various groups who were going to be interacting with these individuals to understand that there were things such as triggers that they were going to naturally experience in day-to-day life, the sound of a car motor or things like that. And so people became aware of like an interplay between mind, external stressors, and their emotional health. Around 1980 is when the diagnosis PTSD became an official diagnosis. And many different therapy orientations at that time began to explore, gee, how do we need to pay attention to this area of post-traumatic stress? The Emdr Community was founded by Francine Shapiro, and she was doing her research, just like many others, with these Vietnam vets. And she published her studies around the late 1980s, 89 or 90. Clinicians in all areas began talking more and more about PTSD. Our veterans, it now expanded to first responders, police officers, firefighters, EMS, and we were looking at symptoms and difficulties that these groups were having, not simply, oh, so-and-so is having a difficulty expressing anger. Well, why? What's the trigger? What is this incident represent for this person? And oftentimes we found a trauma that had happened to the person some years before that they just sailed through because that was their job. They're a first responder. And then something less, quote, dramatic would happen several years later, and then suddenly they're out of work, they can't focus, and it's because, not because they needed a sleeping pill, but because they really needed a therapist to sit down with them and to explore what else was going on for them. So around 2001, therapists all over began to use the term trauma-informed care to really talk about the relationship between past trauma, current behavior, and in years since, the idea has been spreading through every level of patient care and therapy. Gynecologists routinely screen women for abusive relationships. Physical doctors give them the PHQ-9 or a Beck depression inventory or an anxiety scale. So there's more integration all over, and hopefully we will be able to help people build resilience.